Hi, my name is Rachel Steeper. I'm Diabetes Specialist Podiatrist for Swindon in Swindon, and I'm also the podiatry manager. So a big part of my role is developing the strategic side of diabetes care to improve the care to patients with diabetes in Swindon. In Swindon, we're starting a new diabetes referral pathway for patients who've recently developed ulceration. So this is in conjunction with the Great Western Hospital and Sequel, who will be running a clinic at the Great Western Hospital on a weekly basis. All patients who have a diabetes and a new ulceration will be referred to that clinic and seen by a multidisciplinary team. It's incredibly important to do a foot check. The main reason for this is that 80% of problems that develop in diabetes are avoidable. And the best way to do this is by seeing your practice nurse. If you're in a low risk category, she will run through some general checks which will enable her to advise you about your risk status, and that will help you to avoid the risks such as ulceration in the future. A few basic tests, nothing that's painful or anything like that. The main ones are to check, the main tests to do are to carry out a vascular assessment, which is looking at your tooth pulses in your feet normally. The other test is a monofilament test, which applies 10 grams of pressure onto your foot, and that's the type of pressure that could potentially, if repeatedly added to your foot, cause injuries to your foot like ulcers. So ideally with a foot check, you ask your patient at the beginning of the appointment when you're doing your other diabetes checks to take a seat and take their shoes and socks off any hosiery, bring their trousers and skirt up to the knee ideally. The back of your hands, just run your hands from the knees down to the toes gently to see if there are any areas of heat or a difference in temperature. The final test is a monofilament test, where 10 grams of pressure is applied to the foot very gently. You want to check around the feet to make sure the skin is intact, there's no dry skin, no callus. So ideally when you've carried out those tests, again in your practice nurse setting for example, they would be able to put you into a category of either low, increased, high or ulcerated in some situations. If you are ideally in the low risk category, they will hopefully provide you with some leaflets, and that will arm you with information of what you need to do for the next year, which is when you do your next check. If they find that you're in an increased risk category, depending on your local guidelines, you should be referred ideally to an HCPC registered podiatrist who will monitor you more closely. So many patients will only be seen annually for diabetes checks in the practice nurses' surgeries, and it's really important, because there's a year in between that they keep an eye on their feet themselves. It's important to build in really good habits, such as getting into the habit of checking your feet every day, visually if you can, or using a mirror, or asking a family member if possible to help you, in between your toes, your heels and all around the skin, just to make sure that the skin condition is good, there's no open scratches for example in the skin. Don't assume that if it's not painful, then it's not something to be concerned about. Even if it isn't painful, you should get it looked at if there's any areas of concern. So the other thing you can do is the Diabetes UK Touch Your Toes test. This is quite useful in terms of just screening in between that annual review, but it's not instead of the annual review. And this is just so you can pick up any changes with sensation if necessary. It is important to just lightly touch your toes and see if you can feel it as per the guidelines on the website. Other things you can do, applying moisturisers for example is very important, but not in between your toes is quite important as well. Put it around your heels. If you can get to the habit of doing that every day, it doesn't need to be a particularly heavy duty or specialist moisturiser, or even just a light moisturiser applied regularly will work wonders with the condition of your skin. And finally, the main thing really is to, as well as alerting people if you have problems, is to wear the correct shoes on a regular basis. If you wear something with a good fastening, something that's nice and broad as well, you're less likely to damage your feet and develop problems that could lead to complications in the future.